I hope we all do agree, and from what has been spoken, that health is very, very important. Indeed, if you think about the other things that make you live, maybe health is just this one thing that we take for granted. Because if you are not healthy, you'll be dead. And so I think among the things that we say are important, I want us to think through and say, in terms of our mindsets, let's put health first among the things that we think about. Unfortunately, or maybe unfortunately, some of the health issues we are talking about, it's just lifestyle. What you choose to do, what you choose not to do, what you choose to eat, what you choose not to eat, what you choose to inject through your mouth as liquid or gas, well, gas in terms of smoke, and what you choose not to ingest through your mouth as gas. And so there are a lot of choices that we actually make on a daily basis, that if we made the right choices, we wouldn't be worried too much about non-communicable diseases. For instance, good health is critical for human happiness and well-being. Who doesn't like to be happy? Can we all smile? We have been told when we smile, we become healthier. Can I have 3 seconds of smiles? And maybe we should have some practicing lessons of how to smile. So this is partly because health plays a very critical role in boosting economic growth for our country. It also supports and helps in poverty reduction. It is also important in the realization of social and economic goals that we have. Secondly, healthy population, through statistics world over, tend to live longer. Who wouldn't like to live longer anyway here? They also boost labor productivity. In fact, I was shocked the other day that there is a statistic called Labor Productivity Index. And Kenya's Labor Productivity Index is lower than Uganda. It is even lower than Oga, Nigeria. Is lower than Tunisia. And so some of the things that we are struggling with in terms of gross national product, in terms of employment, in terms of income, one can even trace them very quickly to non-communicable diseases that lead to low labor productivity, that then leads to low national output. And I think this conversation is providing us with a very, very opportune forum for us to be able to address something that seemingly is not a problem, but it is actually the devil within us. Also, the other benefits is increased education attainment that you associate with good health, and also good income that I mentioned about. And therefore, one of the things that perhaps you can also associate with good health is that people who have good health tend to save more. Not just because they are not spending money going to hospital, but they are spending more time doing productive work. But also because intuitively in your mind, you know you are healthy, your mind somewhere tells you you will live longer. And therefore there is another little animal in your head that tells you, because you live longer, you must save. And so there is some very interesting conversation that we can have around some of the indirect benefits of good health. And obviously, if we are able to save more, we'll be able to boost investments, which then investments will translate to us having a more productive economy. And if you look at our country in terms of a saving culture, we don't have a good saving culture. And that's why a lot of times as we are implementing large projects, we've got to go outside Kenya because our balance sheet in our banking system cannot accommodate the large funds that are required to implement and fund some of the large projects that we have. So just looking at this conference, I make the observation that the theme, of course, of sustainable development in terms of meeting Kenya's universal healthcare coverage is really very laudable. And this is because it addresses individuals, you, I, and every one of us. It also addresses households. It addresses communities. And for that matter, it addresses countries in terms of prosperity. And so I also make the observation that the conference is timely in the sense that it is giving us an opportunity for us to also reflect on the Big Four agenda. And especially when we look at the 2018-2022 planning period. So in my mind, this conference is actually very well aligned to also the World Health Day, which was celebrated internationally in April 2018, where the theme was universal health coverage, everyone, everywhere. And I think this is what we are trying to achieve here. And so, in a way, we are also being part of that process, having, of course, built from the Makueni Universal Healthcare Coverage number 1, where the theme was meeting Kenya's Universal Healthcare Challenge. We held this conference on 4th and 5th of April. I was one of the speakers, and I must say I was very delighted to have sat through and participated in that process. And so, ladies and gentlemen, Kenya's agenda for universal health coverage is firmly anchored on international, on regional, and national development frameworks. It is not something floating in the air. These frameworks, of course, do target the achievement of equitable development frameworks in terms of quality of health, in terms of good health care, and looking at the population at all ages. And so to effectively address the issue of health, most countries all over the world have been strategically planning their projects, they have been strategically planning their programs so that they achieve these aspirations regarding health. And these frameworks, which do form the reference point for Kenya health agenda, include Sustainable Development Goals, which we know SDG 2030, the African Union Agenda 2063, also locally in our country, the Kenya Vision 2030, and also let me emphasize our Constitution. So we've got a framework that is anchored on very, very clearly understood and enshrined frameworks. So let me just comment briefly on some of these frameworks and how they relate to the conversation that we have today. So if you look at the Global Agenda 2063, which is Sustainable Development Goals, there is this concept about leave no one behind, where the SDGs call for strong partnerships, they call for new and innovative ways of working together. And that is why we have all of us here, because we want to think about innovative ways where we work together and deal with this little devil, or maybe a big devil, of non-communicable diseases. And so the Sustainable Development Goals, specifically goal number 3, which deals with people, seeks to ensure that we have got healthy lives, and also we promote well-being for all people at all ages. The goal has several targets to be observed by the year 2030. And let me also clarify that the achievement, the implementation, the monitoring and evaluation of Sustainable Development Goals is one of the directorates in my State Department for Planning. So this, to me, is critical, it is important, it's absolutely necessary for me to deal with it. And so one of these targets is reducing maternal mortality ratio to less than 70 per 100,000 live births. A second one is to reduce neonatal mortality to 12 per 1,000 live births, and under 5 mortality to be reduced to 25 per 1,000 live births. Another one is to end epidemics of HIV, AIDS, TB, malaria, and neglected tropical diseases. And maybe there are some neglected tropical diseases that are triggers to the NCDs, the non-communicable diseases. I'm not a medical doctor, but maybe there could be some association that we could find. It also focuses on combating hepatitis, waterborne diseases, and other communicable diseases. Number 4, reduction by 1/3 premature mortality from non-communicable diseases through prevention and treatment. Number 5, to strengthen the prevention and treatment of substance abuse, those things that we inject and ingest, including narcotic drugs, abuse, and harmful use of alcohol. Number 6, having the number of deaths and injuries from road traffic accidents. Number 7, ensuring that there's universal access to sexual and reproductive health care services. Number 7, achieving universal health coverage. And you can see achieving universal health coverage is one of the targets within the Sustainable Development Goals. It is specifically stated in goal number 3. Finally, number 9, substantially reducing the number of deaths and illnesses from hazardous chemicals, air, water, and soil pollution. Let me just comment on Agenda 2063 very quickly. In Africa, the African Union Agenda 2063 is a strategic framework for the socio-economic transformation of the continent over a 15-year period. This framework builds on and seeks to accelerate the implementation of past, existing, and new regional, national, and continental initiatives for transformative, inclusive, real growth with equity, rapid, resilient, and sustainable socioeconomic development. And one of the aspirations of Agenda 2063 is a prosperous Africa, which is based on inclusive growth, sustainable development, and among the goals of this aspiration is to achieve healthy and well-nourished citizens with priority areas being health and nutrition. And so this Agenda 2063, as you'll see, it ties very closely with the SDG goal number 3, and also one of the priorities in the Big 4 agenda regarding health and also food and nutrition. So coming back home, in Article 43 of the Constitution, there is the issue about economic and social rights in our Constitution. And this economic and social rights states that every person has the right to the highest attainable standards of health, which then includes the right to healthcare services, including reproductive health, and then, in this case, then the health sector, and I like what we heard from my colleague from the Ministry of Health, has been endeavoring to achieve this aspiration by implementing effective and efficient strategies. Turning to our long-term development framework, Vision 2030, in the social pillar, we identify that the health sector has got a vision of ensuring there is equitable, there's affordable, and there's quality health care to all the Kenyans at the highest standard. So we are actually doing something that is very clearly identified in Vision 2030, which was launched 10 years ago. And so this is done to recognize that health is very important. If you look at our medium-term plan 3, which is what we are implementing now for the period 2018 to 2022, we are focusing on the achievement of universal healthcare coverage by implementing programs that increase insurance coverage and access to quality healthcare services and offer financial protection to people when accessing healthcare. This is in line with the President's transformative pillars of change in the Big 4, obviously, which one we know is universal health coverage, the food and nutrition, manufacturing, and affordable housing. And so towards the achievement of universal healthcare coverage, the government will continue to invest in provision of quality and accessible healthcare. And so to realize this, there is a lot of work that is going to be done around the National Health Insurance Fund to make sure that it is fit for purpose and it is able to support the framework of universal health coverage. Again, to demonstrate the commitment of the government of Kenya to universal health coverage, on the 13th of April in the year of our Lord 2018, His Excellency the President did launch a comprehensive NHIF medical scheme amounting to Kenya shillings 4 billion for all students in public secondary schools to insure them for all kinds of injuries and diseases. This obviously is designed to ease the financial burden of parents, especially in cases of emergencies. There's also another program which is Health Insurance Project for elderly persons and people with severe disabilities to cover about 1.5 million persons by 2022. In the counties, the government shall also scale up the provision of specialized medical equipment that already has been mentioned by the speakers before me. I also recognize, ladies and gentlemen, that the health sector has performed reasonably well in the last 4 or 5 years, and the statistics that have also been shared by some of my colleagues is a testimony that we are moving in the right direction. But I believe we can move even faster if we fix this area of non-communicable diseases. So while we acknowledge the achievement in the health sector, a lot more needs also to be done to achieve the goal of universal health coverage for the benefit of all Kenyans. And so here it is important that we continue leveraging on synergy through partnerships and collaborations and take advantage of the goodwill of development partners on financial and technical assistance, private entities, specifically through the PPP framework, faith-based organizations, non-government organizations, community-based organizations who participate a lot in delivering health services so that we can touch every corner of the country and all the people in Kenya. We also must continue to identify and implement innovative mechanisms that are necessary for effective implementation of our programs, of our projects in the health sector and sustainable financing of health services. And so bearing in mind that the health sector is closely linked with other sectors in the economy, it is important that we all continue thinking about a multi-sectoral approach to dealing with the issues in the health sector, and especially on the NCDs as we are discussing today. It is therefore essential for successful implementation of these programs and projects for us to think outside the box, as we keep on saying. For instance, the output of the health sector, that is good health among our people, is a key input to other sectors. For example, the performance of the agricultural sector and manufacturing are dependent on a healthy workforce, while the manufacturing sector supports the health sector, for instance, through manufacture of pharmaceuticals. And so there is a lot of backwards, forward, and lateral linkages that we can very quickly identify. If I was teaching a strategy class, I would actually ask someone to write a thesis on the backwards, forwards, and lateral linkages in the health sector, which can demonstrate actually this sector is key to a lot of things that we try to address the symptoms, yet the cause is something which is sick, which is wrong with our health sector. And for that matter, I'll drill down on the NCDs. So let me just say a few things on the data so that I can conclude. That we need accurate, we need relevant, we need up-to-date data, which is very important for us for planning, for monitoring, and evaluation of the health sector. I once had an interaction with GSK in their previous name, and they used to say, if you are not measuring what you are doing, you are practicing. And so it is for us very important that we come up with good data so that we can be able to have good indicators to demonstrate and check and evaluate whether the programs that we have are actually working and whether we are getting value for money in terms of the programs that we are implementing. And this is also very important for the partnerships that we have and that we have suggested. So to also enhance and also have acceptance and ownership of the health sector, and indeed all sector policy programs and projects, we need also a very articulated, consultative, and participatory process in dealing the issues in this health sector. We should therefore endeavor to involve all stakeholders, and in particular communities at the grassroots level. Public engagement is very important, especially in the entire cycle, including monitoring and evaluation, so that we get it right. So as I conclude my address, I wish to reiterate the importance of this conference to the State Department for Planning, and especially the National Treasury and Planning Ministry, where I serve. This is because the mandate of the State Department for Planning is to coordinate both national and development planning for counties in the whole of the country, as well as coordinating the implementation, monitoring, and evaluation of Sustainable Development Goals. The outcome of this conference, I hope, will be very useful for us in policy formulation, in planning, in budgeting, and especially with respect to the health sector, where we have actually received information that the multiplier effect of a shilling invested in the health sector is so big. So in conclusion, ladies and gentlemen, I wish to reiterate the importance of this conference. And looking at the mix of participants who are here and what has been shared, I am very confident that the quality of the output from this conference will be very, very useful, to be very high, and I look forward to receiving practical, implementable, and relevant recommendations from this. And obviously, I'll be looking for them to be innovative. It should not be the same thing that we have done in the past, and it has not worked. We must look for something new, innovative, and something that is fit for the purpose given the current times. And so, as we do this, let me once again offer my compliments to the organizers of this conference, and also request that we start planning for Universal Healthcare 3, which, can we clap for Kisumu again, in case you have forgotten, which is going to spearhead this Universal Healthcare Conference number 3. I don't know whether we focus on diabetes, I don't know whether we focus on cancer, I don't know whether we focus on high blood pressure, but then I will leave to the organizers to look at the finer detail and determine what indeed is important for us to progress at Universal Healthcare Conference number 3. With these very many remarks, I declare this conference officially opened. Thank you very much.